So thank you for joining us tonight. My name is Phil. I am one of the pharmacists here at Healthy Choice Compounding Pharmacy. Tonight we have the pleasure of having Dr. Kellman with us. Go ahead, Corinne. What are you doing? You ready? Slide two. We've been compounding since 1997. About 5.5 years ago, we went from a hybrid type of situation to a state-of-the-art USP 800 compounding facility. This is all that we do. So we're about 3,000 square feet. As personalized medicine has grown and will continue to grow, we're here to grow with you. Genetic testing is really key. People with allergies, sensitivities, as Dr. Kellman's going to speak to tonight, this is where a customized or personalized medicine will come into play. We're all about dedication. Dedication is about providing cutting-edge information from Dr. Kellman tonight about educating patients so they understand the options available to them, educating physicians to give them more tools for their toolbox so they can help more patients. And what we do is we create. We create personalized type medications for each individual person. Some of the ways that we help through bioidentical hormones, men's health, women's health. Dr. Kellman and I have worked on doing a lot of thyroid replacement therapy. We must make over 1,000 different thyroid type preparations for his patients because he personalizes it so much. People with autoimmune disease, really low dose naltrexone is a home run for them. Dermatology, topical pain management. It's really about finding what's going to work well for you. You know, giving your physician and you more tools so you can achieve optimal health. And we can do that through different dosage forms. Dr. Kellman and I were talking prior about using sublingual tablets for some medications, capsules, creams. It's really about finding what you need to make you healthier. Here's our contact information. Obviously, you've all been on our website to register. As Corinne said, there will be, this is being recorded, so you'll be able to see Dr. Kellman within a day or so. And at this point, I'm going to turn it to Dr. Kellman, but I'm only going to read a small portion of his bio because otherwise I would take up the whole time reading his bio. Dr. Kellman is the founder of Microbiome medicine, a unique discipline formulated through a holistic combination of internal medicine, ecology, philosophy, and Kabbalah. He was the first doctor to identify an integral role in the microbiome in general health and in most illnesses and epidemics. From his unique vantage point, Dr. Kellman is able to connect the dots of the unseen world and has revolutionized the treatment of chronic and hard-to-treat conditions. He has written numerous books on the subject and speaks frequently in the international media medical summits and health shows. Dr. Kellman is widely respected as a groundbreaking force in the alternative medicine and microbiome movement. Dr. Kellman's philosophy is the forefront of the new era in medicine, well beyond the functional holistic medicine practice today. Dr. Kellman's unique approach to illness doesn't ignore traditional and holistic medicine, but uses that as a starting point to dig much deeper into the entire system. Comprehensive pathways for the unprecedented opportunity of the deepest level of healing. Dr. Kellman has treated tens of thousands of patients from all over the world, many of whom have come to him after suffering for years or are frustrated by traditional medical treatments. Dr. Kellman is driven by his desire to alleviate suffering and help people to regain health based on a new vision and understanding of healing and the cause of disease. Trained in internal medicine, Dr. Kellman uses the latest drugs and technology to treat specific diseases with a patient-centered and holistic approach. He focuses the complex interaction of the systems, not just the disease, but on you as a whole person, much greater than the sum of your parts. He never treats merely the symptoms of an ailment. He digs much deeper and finds the reason why the individual has the illness in the first place. He treats that deficiency, which results in true healing at the deepest level, not just the alleviation of symptoms. And this I can personally attest to by seeing all of his accomplishments over the year, by treating patients who have been pushed off by other physicians who didn't have the proper answers. So Dr. Kellman, at this point, I'm going to turn it over to you.
Okay. Thank you, Phil. Thank you. All right. So let's get started. We're going to be speaking about fatigue and the numerous causes of fatigue. Fatigue is a major problem. Let's go to the next slide. So many people suffer from fatigue. It's the #1 reason why people go to doctors. Okay, let's go. As Phil already said, that I'm an internist. I trained in internal medicine. I been practicing holistic and functional medicine since 1999. Written a number of books on general health and also on the microbiome. Okay, we'll go to the next slide. Okay, now so many people complain of fatigue, and fatigue is manifested in many, many different ways. Some feel just like their body has no energy. Some feel mental fatigue. Some people feel just sleepy. So there are many, many different manifestations of fatigue. But the bottom line is this can be treated. We can find the causes and we can restore your energy. Go to the next slide. Okay, so there are many, many causes of fatigue, but it also causes many other symptoms, and many other symptoms are frequently associated with fatigue, like anxiety, low mood, sometimes muscle and joint pain, sometimes memory problems, poor concentration, lack of vitality. We'll go to the next slide. Fatigue, of course, is a risk factor for many, not only for accidents and injuries, but it's typically a risk factor for many, many other conditions. And that's because the underlying causes of fatigue are the risk factors for other conditions. We'll go to the next slide. Okay, here's the bottom line is that you can get your energy back, and that's my promise to you. And we'll see some of the answers in this presentation. Okay, let's go to the next slide. Now, there are a number of causes of fatigue. Low thyroid is a very, very common cause of fatigue. And frequently that's diagnosis is missed. Microbiome, and we'll discuss that in a few minutes. Microbiome imbalances is another major cause of fatigue. And many people can have microbiome issues and they don't even know it. They have no gastrointestinal symptoms, but yet there's problems in their microbiome, and that is a contributing factor to their fatigue. Inflammation is another very important cause of fatigue. And inflammation could be silent, that you don't even know that you have chronic inflammation as a cause of your fatigue. We'll go to the next slide. Okay, so there are a number of different tests that we do to try to understand why someone develops fatigue. There are better thyroid testing that I mentioned, adrenal testing. Sometimes we have to look for mold, toxic exposures to, let's say, mold and heavy metals. Stress is a major, major cause. There's ways of evaluating stress. I do a test called a pseudoscan, which actually measures your autonomic nervous system. So we can actually see and objectively quantify and better understand the causes of your anxiety and your stress. And then there are specific technologies that we now have that can improve your stress response by improving your autonomic nervous system. All right, we'll go to the next slide. Okay, let's talk about thyroid. When your thyroid is low, you're tired, you have anxiety. Weight gain is a very, very common symptom of low thyroid. Constipation is another, brain fog, poor memory. You need the proper thyroid testing. Many people are told your thyroid is normal because they did routine blood tests and they seem to have come back normal. But the routine test can frequently miss the diagnosis. Let's go to the next slide. As I said, there's a better thyroid test that I do called the TRH stimulation test, and we'll talk about that in a few minutes. Now, low thyroid can lead to many other problems, and many other problems can lead to low thyroid. So a low thyroid could cause leaky gut, the intestinal permeability. That could also contribute to food cravings. It can lead to low thyroid, can lead to weight gain, both because of food cravings and because your metabolism slows down. and also because it leads to inflammation. So you can see that it becomes a vicious cycle. We'll go to the next slide. Fatigue is one of the most common symptoms of an imbalanced microbiome. So that's another place that you have to evaluate, another system that you need to evaluate to better understand why you may be complaining of fatigue. Many factors can cause a microbiome imbalance, such as stress, poor diet, food sensitivities, autoimmune conditions, etc. Go to the next slide. Okay, good. Okay. These are some of the microbiome superfoods that I use to improve the microbiome. I describe all of this in my book, The Microbiome Diet. Go to the next slide. The top 10 benefits, there's dark chocolate, believe it or not, is a very important microbiome superfood. And I use that to improve the microbiome as well. We'll go to the next slide. Now, probiotics are very important compounds that I use for fatigue, but not all probiotics are the same. There are some probiotics that you use for autoimmune diseases. There are some probiotics that you use for cancer or for low immune function. And then there are different probiotics that you use to stimulate energy production. That's how diverse the bacteria are. So you need to know which are the best probiotics to improve energy production and metabolism, and certain probiotics help specifically with weight loss. And then there are prebiotics, which are the nutrients that feed the bacteria. There's so many different types of prebiotics. Now, it's not just fiber, but also pomegranate seeds and many other polyphenols. And now the research is showing that also can be very effective prebiotics. Butyrate is a compound that I use to improve the microbiome. We'll go to the next slide. These are some of the herbs that I use. Now, why would I use ashwagandha, rhodiola, ginseng? Because adrenal fatigue, which really means the hypothalamus pituitary adrenal axis. The hypothalamus is a gland in the brain that produces many, many hormones that regulate all kinds of physiological functions in the body. Brain function, the stress response, glucose metabolism, cardiac function, etc. And the adrenal gland is the final gland that all these messages reach. And the adrenal gland produces many hormones and messenger molecules that are involved in very complex physiology. So if we diagnose your cause of fatigue due to adrenal fatigue, which is really a catchphrase for really meaning the hypothalamus, a gland in the brain, the pituitary gland in the brain, and the adrenal gland, the flow of communication is altered, and then the adrenal gland gets weakened. Ashwagandha, these are just some of the herbs, rhodiola, ginseng, cordyceps, these are just some of the herbs that I use. The trick is to know which herbs to use. Every person's different, and you need to use the right herbs for a particular person and a particular condition. Go to the next slide. Okay, so it was a quick seminar, but I want to focus a lot on questions, but I want to just recap the main causes of fatigue. And one, as I mentioned, is low thyroid, but the routine tests are frequently normal. That's why I do a much better thyroid test called the TRH stimulation test, which research has shown, and unfortunately, most doctors don't do it. This is the best test to definitively determine if you have a low thyroid. And I mentioned some of the symptoms of a low thyroid include fatigue, of course, mental fatigue, physical fatigue, muscle pain, joint pain, constipation, brain fog, poor memory, depression, anxiety, some hair loss. So when the fatigue is associated with some of these other symptoms, you have to think low thyroid. And then I mentioned the microbiome. Microbiome imbalances can also be another major cause of fatigue. And you may not know it because you may not have any gut symptoms at all. And then there are a number of different ways of testing for microbiome imbalances, biochemical testing, stool testing, breath testing, to see, to get a better picture of what's going on in the microbiome and the metabolites that they're producing. And then we can improve the microbiome with the right types of probiotics and the right types of prebiotics as well. Um, uh, and then there's inflammation. Now, inflammation is a major category of disease, and it causes widespread symptoms, frequently pain and brain fog, brain neurological symptoms, but sometimes just fatigue. And inflammation is due to toxins, is due to microbiome issues, leaky gut symptoms. Leaky gut is when the intestinal wall that is charged to keep toxins from not coming into the body, but at the same time enabling nutrients to flow through. That's a difficult task. And frequently people get what's called leaky gut. It really means that the intestinal wall becomes too permeable and toxins leak through, partially digested foods leak through. This activates the immune system and you can get widespread symptoms, including fatigue and brain symptoms. And that can be evaluated as well as another factor for your fatigue, and it can be healed. That's the bottom line. Then I mentioned adrenal fatigue, which is, again, the abnormal communication between the different glands, two glands in the brain, the hypothalamus and the pituitary, the adrenal gland, which sits on the kidneys. These hormones play a vital role in all kinds of physiological expressions, and the adrenal gland produces many hormones, and then the hormones activate messenger molecules, and then the messenger molecules activate and send messages to other messenger molecules. It's a complex, amazing web of communication. It's a whole grid, and with chronic stress, with toxins in our environment, with the stress. I mean, just a year of COVID, it affects the autonomic nervous system. I mentioned that there are now ways of really evaluating the autonomic nervous system. I have a machine, it's incredible advanced technology called a pseudoscan that can actually evaluate your autonomic nervous system. The autonomic nervous system, again, are these nerves that come out of the brain down the spinal column, and they innervate the heart and the blood vessels and the kidneys and all the organs in our body and the gut. The sympathetic component of the autonomic nervous system is the fight or flight, like we're running away from the tiger when we're stressed, and then the heart pumps faster, the vessels constrict, the brain functions differently. And you're more susceptible to inflammation and clotting. And we don't want to be in that sympathetic state all the time. We need it in particular moments, and then we need to get back into the other system, the parasympathetic state, which puts us in a calm state. It really keeps the gut healthy, and it modulates our physiology, and it guides our physiology in a healthy way. Now, what I find when I do this pseudoscan is that many people, their physiology is actually charged or is orchestrated by the sympathetic nervous system, which means all your organs and all the systems, physiological systems in your body is being orchestrated and controlled by your stress response. And this is why stress is associated with disease. But now we can actually see it. We can get objective evidence for it. We can quantify it. And then I have technologies in my office. One is called the Magnosphere, which takes up like a room. So if I bought this technology and takes up so much real estate in New York City, it's valuable. And it's an electromagnetic field that a healthy autonomic nervous system resonates with. And this, after 5 treatments, can put your autonomic nervous system back into a healthy state, where now the parasympathetic system is actually guiding physiological expression. It's a phenomenal treatment. I think it's a revolutionary treatment, and it heals stress at a very, very deep fundamental level. And there's one other cause of fatigue, which I did not mention, and that's mitochondrial dysfunction. The mitochondria are a component of the cell that actually used to be bacteria. And they joined our cells, and they're involved in energy production. And there are numerous nutrients and compounds that are in the mitochondria involved in energy production. When we develop free radicals, inflammation, toxins, they can break down the delicate mitochondria, and then our ability to produce energy becomes suboptimal. Cellular function becomes dysfunctional, and then that leads to more free radicals, more inflammation, and frequently that's another underlying cause of fatigue. There are now ways of measuring this, of getting blood tests to assess for this, and I have a whole protocol to improve mitochondrial function with natural compounds, and of course, alleviating the cause of inflammation and free radical production as well. So one of the treatments that I use, in addition to nutrients, nutraceuticals, herbs, et cetera, is various peptides, which are immune modulators, which are very novel. They're used as subcutaneous injections. It's really an incredible advance in holistic medicine. These are actually compounds found in the body that have been isolated and then produced that improve various physiological functions. So for example, there's a peptide that I use that stimulates growth hormone production, which helps with fat breakdown and improves muscle fat ratio. And then there's peptides that stimulate mitochondrial function. And then there are peptides that improve brain function and on and on and on. And holistic medicine, functional medicine is evolving very quickly. And there's a virtual merger of holistic and conventional medicine. There's an interface where it's almost difficult to distinguish where, which side of the border are you on, and that's a good sign. But that's for a whole other seminar. So I'll take questions now, but here's the message. The bottom line is, if you're suffering from fatigue, if you're suffering from brain fog, cognitive changes, poor memory, anxiety, stress, and invariably it's associated with fatigue and sleepiness and lethargy. There are causes. We can find these causes. Unfortunately, conventional doctors, that's not what they do. And going to them is, unless you have anemia and you're, God forbid, bleeding, in the gut, and you're anemic, or your periods are causing anemia, or God forbid, a serious disease, the major causes of fatigue is not addressed. The presentation that I gave are the causes, and it is addressing the cause of your fatigue. And hopefully, if you have the fatigue and associated symptoms, you'll come see me and I'll absolutely be able to help you. So let's go to questions.
Wow, awesome, Dr. Kellman. That was very informational. Okay.
Thank you.
All right, let me see. Phil, did you get any questions while we were in the chat? Okay. Sharon asked this. Do you have a center in New Zealand?
Oh boy, I wish I did, but we do phone appointments. I love New Zealand. I would love to come there for a month, a year. But we do phone appointments. We have people from all countries all over the world, and I'll be glad to help you long distance with a phone appointment.
And one of the questions were, how do you distinguish which supplements are the correct ones for each individual person?
It's a very good question. And that's the science and the art of holistic functional medicine. It's something that you could teach, but you can't teach. It is a science component, but there's an intuition, there's an art component, there's for lack of a better word, there's a metaphysical aspect to that ability. But number one, you have to understand, you have to have a theory and a general way of understanding health and healing, how nature heals, how the body heals. That's fundamental. And then you need to do appropriate tests to see if the systems of the body are functioning properly, if cells in the body are functioning properly. But if you have a model of how healing happens and why people get sick, then you'll know what to look for. You'll know what to test. You'll understand when you get results what they imply. You'll make sense of the footprints, and you'll make sense of the dots that don't seem to be connected. But you need to know and do appropriate testing. So I mentioned proper thyroid testing. I mentioned microbiome testing, which are not stool testing, breath testing, various blood tests that show markers, biochemicals that different bacteria produce, biochemicals from inflammation you could test for as well. And there are numerous markers of inflammation, and this is not done in a conventional medical office, but these are what I call footprints of disease. And then you know, based on what you pick up, which supplements are best, because there's research to show, for example, which supplements, which herbs lower best these inflammatory markers, and which nutrients lower, which herbs lower these inflammatory markers. So you have to use both the science, the testing, and the art of medicine to make that decision.
I agree.
Good
I've
question.
seen Dr. Kellman do that many times. His intuition has come into play many times.
That's the part that keeps you charged.
And that's the part you can't teach. That's an innate ability. We also got a question: is molasses a good source of butyrate? And what other foods do you recommend for butyrate?
Well, first of all, I would say no. You're getting too much glucose from that, but short chain fatty acids, eating fiber-rich foods, a lot of the microbiome superfoods that I mentioned that you can find in my book, that artichokes, Jerusalem artichokes, asparagus, leeks, many foods, greens in general, polyphenols, pomegranate seeds, like I mentioned, they get broken down, the fibers, and they produce butyrate. But you could take butyrate as a supplement. Okay.
Yeah. Corinne?
And we've got a question from Curtis. Have you ever seen seasonal fatigue? In the summer, my energy goes way down, such as yawning, naps, etc.
Yeah, I mean, I think that's probably adrenal mediated. When I hear the word sleepiness, I think more adrenal, because you're not producing the hormones that keep your blood glucose up, that respond to changes in body in temperature. The hypothalamus pituitary adrenal axis is called into action when there's temperature changes. So if your symptoms are mostly in the summer, my bet would be that you have dysregulation of the hypothalamus pituitary adrenal axis of communication. And with the appropriate testing, we can make that diagnosis and then intervene accordingly.
Gotcha. So now we have a question from Linda. How do you determine if a patient would do best in intermittent fasting versus the ketogenic diet?
Ooh, very sophisticated questions. So is the question, how do you determine which one you should use, intermittent fasting or a ketogenic diet?
Yeah. How do you determine which is best for the patient?
Well, I mean, it depends on, what your condition is, what symptoms you're suffering from. Intermittent fasting, everyone could benefit from. I don't think that people need to do it all the time. I think intermittently is very beneficial, to have a significant period of time that you're not eating. that recharges the mitochondria, by the way. Ketogenic diet is a big discussion. I think that there's benefit to it. Look, I'm more guided by improving microbiome, because too much of a ketogenic diet also has some negative effects associated with it. I see this frequently. I see elevated blood glucose and abnormal lipids sometimes. So there are negative effects that are not spoken about because no one's testing for it or seeing it. Unless they're coming into the doctor's office who's testing for it, no one's going to report it. If it's just out in blogs and in magazines, but it's not actually being evaluated in a doctor's office who's looking for these possibilities, no one's going to know about it. So it's not without negative effects. And yet the ketogenic diet absolutely has some value. I personally feel that plant-based diet is key with the appropriate oils, fatty acids, fat, and lean protein. I'm definitely into, chicken and meat too, in moderation, grass-fed. I'm not a big believer in eating a lot of meat, but that's again a subject in itself.
We have another question from Linda, which I think is a great question that not a lot of people talk about. Her question is, I'm going to do it backwards for you, Linda. What is your recommendation for someone on a statin drug whose cholesterol is down to 120, which I think is a terrible thing right there, with an HDL of 39, a triglycerides of 156, and LDL of 55? She also asks, what peptides do you use to help a stroke recovery?
Very good. Let me answer the second question too. Peptides for stroke recovery, there's a number of things. Dihexa is one, Cmax and C-Lank would be the top three. Dihexa is critical. You could read about it, DIHEXA, and then Cmax, SEMAX. Those are the peptides, but also IV therapy of phosphatidylcholine, glutathione, phenylbutyrate. Phenylbutyrate, a compound produced by bacteria, has incredible positive effects on the brain. It has anti-inflammatory effects. It turns anti-inflammatory genes on, pro-inflammatory genes off. It improves insulin resistance. It's almost a miracle compound produced by our greatest ally, the microbiome. It's probably the most incredible compound in functional medicine. Guess who produces it? Our greatest ally, bacteria. So that hopefully scratches the surface about your second question. In regards to the first question, tell me the first question again.
Let me go back to it. It was what is your recommendation for someone on statin drugs who's down to 120 with an HDL of 39, triglycerides 156, and an LDL of 55?
Well, I mean, that's already getting too low. I think that cholesterol's too low. There are some great natural herbs, compounds like bergamot that will improve cholesterol and improve, I like to use the word dyslipidemia, meaning abnormal HDL, abnormal LDL, and then there's all these, you also want to measure the size of HDL, the size of LDL. The small LDL particles are more atherogenic. So you need a big picture before you make a determination of, which, what medicines to be on, if at all. And also, you could go on low dose statin medications, like just 3 days a week. People don't realize that you don't have to be on high dosages. You could be on low dosages of statin medication. I would like to see your cholesterol much higher than 120. I would definitely use bergamot. I would use berberine. And then you got to get more information. You got to look at oxidized LDL. You have to look at, is there vasoconstriction constriction or vasodilation. The pseudoscan actually evaluates small vessel function. You want to look at what's called endothelial function, and to make this determination of how aggressive you want to be. The statins, they have anti-inflammatory effects, which is amazing, which is probably the main reason, or at least a very important reason, of why they reduce morbidity and mortality in terms of cardiovascular disease. So we need to see a bigger picture before I could give you an answer about, should you be on a statin medication? Should you lower the dose? Should you raise the dose? So I hope that gives you some general idea of my approach.
I'll just throw my 2 cents into that.
Please.
For a person with such low cholesterol, especially a woman, all of your hormones are made from cholesterol. So
That's
if
right.
you don't have enough cholesterol, you're not making your pregnenolone, your progesterone, your DHEA, your testosterone. All your androgens go along with that. So dry skin, mental fog, that could all be due to low cholesterol as well.
Absolutely. Great point. Absolutely.
All right, so we have another question pop up. What about chronic fatigue caused by Epstein-Barr? Any suggestions there?
Yeah. Well, again, believe it or not, I use a peptide called thymosin alpha-1, which has antiviral effects and immune modulating effect. We do high dose IV vitamin C for viral infections. There are a number of different herbs that are beneficial for viral infections. So Epstein-Barr virus, yeah, that in some people is a cause of fatigue. Yes.
All right, we have a question from Denise. Where would you put hormonal reasons for fatigue in your causes of fatigue? Under blood markers or related to thyroid?
That's a good question, because there are other hormones. We mentioned adrenal, we mentioned thyroid, but there's also estrogen, progesterone, and testosterone that could be a contributing factor as well. So that would be, we would draw bloods and do blood testing and see if that's a factor.
Gotcha. And we got one more question from Linda. She said, do you prefer the NMR lipid profile with a graft, or do you use another test?
No, that's a good test. There's also the Boston Heart test that we do as well.
So it's 7:40. We'd like to thank everybody for joining us tonight. Any additional questions for Dr. Kellman? You can email Dr. Kellman at his contact information. You can email us directly and we'll pass it on to Dr. Kellman. I want to thank Dr. Kellman again for coming on again.
Thank you.
Hopefully we'll see him in the fall. We're going to take a break for July and August, and you'll be seeing our emails and contact information anytime. You can always reach out to us through our website, through texting us, calling us. We're always there to help answer your questions for you.
And I want to thank you, Phil, and Healthy Choice, and everyone that's done such a great job in producing this. Thank you.
Yeah.
Of course.
But I will say
Rennie,
one thing about Dr. Kellman.
Works in my office. Rennie is in charge of PR and marketing, and she does so much work in our office, and she really contributed to this presentation. So thank you,
Yes,
Rennie.
absolutely. But I will tell you, Dr. Kellman does use all the tools in his toolbox. I call a lot of the other doctors, more corporate doctors, they do just a takeout menu where Dr. Kellman does the whole smorgasbord. So I'll attest to seeing his results as well. So thank you for all you do.
Thank you.
All right, guys, people, thank you for joining us. Have a great night, and we'll see you in the fall.
Thank you, guys.
Thank you. Have a great night.
Bye-bye.